Committee on Aging. Bobby, would you call the roll?
Sue Ashton,
Here.
Heidi Bassford Kirkhoff,
Here.
Julie Kiefer,
Here.
Lurton Blassingame,
Here.
Ron Durkop,
Here.
Sandy Kleckles excused, Julie Maslowski,
Here.
Judy Ritchie,
Here.
Deb Allison Osby is excused, and Jean Wallerman is excused.
Okay, thank you. And everyone got the minutes by email. Are there any additions or corrections? If not, I'll take a motion to approve.
So move.
Second.
Discussion? All those in favor?
Aye.
Opposed? Okay, they're approved. Citizen statement, Aaron?
Not much, no. Not much from us.
You want to come up and use the microphone? Okay.
I'm good.
I'm not sure that the sound will pick up.
There's not much more to report today.
Okay. There is. Cindy Draws, who was with us last month, is retiring right after the Senior Expo in October. And she's, yeah, that is something important. Okay. Under new business, we have Joan Jaworski and Julie Nix, who are the elder benefit specialists from the ADRC. They'll give us a little overview of the ADRC and then going into the Medicare open enrollment information. For the benefit of our viewing audience, we did have a slide presentation to show. We've got some technical difficulties, so it'll be available for viewing on the ADRC website and also on the City of Oshkosh website under the Committee on Aging minutes when we get those on for this month. We'll remind you again a little later. So, Julie and Joan.
I'm Julie Nix, the Elder Benefit Specialist with Winnebago County in Neenah.
I'm Joan Jaworski, the Elder Benefit Specialist in the Oshkosh office.
We're just going to do a brief overview today. I'm going to start with the folks who work for the ADRC, which I am one of the staff members for the ADRC. The ADRC is the Aging and Disability Resource Center for Winnebago County. There are quite a few different types of staff for the ADRC. There are people who are known as information and assistance staff. They serve people over 60 or adults over 18 with physical or developmental disabilities. They offer long-term care options counseling, access to long-term care programs such as Medicaid for long-term care, and they also provide community resource information to folks who call in or stop in. There are also adult protective services staff. They perform welfare checks on people. They help with powers of attorney, setting up guardianship for people who need it, and sometimes do involuntary placements of people. We have a new worker that is a dementia care specialist. She does memory screenings, and the information assistance folks also do memory screenings. She provides information and assistance to people with memory or cognitive concerns and the family or friends who are caregivers of those people. She helps to develop dementia-friendly communities and helps train the community on how to be dementia capable. There are also disability benefit specialists. They pretty much do our job, but for people age 18 through 59. They assist with Medicaid and food share applications. They do a lot of assistance with SSI and SSD, which is Social Security Disability, applications and appeals. They provide basic housing and transportation information, some Medicare counseling for folks who have Medicare due to having disability, and they do public outreach for the available programs. I am an elder benefit specialist. We serve people age 60 and over. We assist with Medicaid, food share, senior care applications, among many other things. We provide basic housing and transportation information for people. We do a lot of Medicare information and counseling for folks who are turning 65, provide help with Medicare annual enrollment. We give group welcome to Medicare presentations, very in-depth presentations, and we also do public outreach for the programs that we cover. I want people to know that all services that are provided by the ADRC are at no cost to the consumer.
I'm going to continue with the Medicare overview, and again, it is just a brief overview. As Julie stated, we do 8 Welcome to Medicare presentations a year. Julie does 4 up in the Neenah office, at the Neenah Library, and I do 4 at the Oshkosh Senior Center. Our 2020 schedule is not set yet, but you're welcome to call the ADRC to get that schedule. Probably in December sometime we will have next year's schedule set. So Medicare is an entitlement program for people age 65 and older, or those that have been determined disabled by Social Security and have received that disability payment for 24 months. You have your choice of doctors, hospitals, and clinics as long as they're Medicare certified. There's different parts of Medicare. Part A is known as the hospital coverage. There's no charge for Part A, but there is a deductible. So if you have Medicare and go into the hospital, you will owe $1,364 for that hospital stay. That amount does change annually, so it tends to go up every year. Part A also covers the skilled nursing facilities and hospice. There's other benefits as well, but and we go through a lot of those other ones at our presentations. Part B, commonly known as the doctor coverage, covers everything that is not an inpatient hospital stay as long as it's a Medicare covered procedure. So it covers their doctor visits, lab, x-rays, MRIs, ER, outpatient surgery. All of that is covered by Part B. That is not free. The 2019 premium is $135.50, usually automatically deducted from your Social Security check. It too has a deductible, $185. After that, Medicare will cover 80% of the medical charges. So many people don't want to be responsible for what Medicare doesn't cover, that hospital deductible, the Part B deductible, and the 20% that Medicare doesn't cover. So they choose to add a supplement to their Medicare. You do have to have the Part A and the Part B to get a supplement. Medicare pays first as primary, then the supplement picks up the balances, usually as long as it's a Medicare certified procedure. All supplements will work where Medicare works. The same benefits are available through all the companies, but there's a wide range of monthly premiums. So you do need to see a licensed insurance agent in order to look at supplements and have them quote you a price and enroll you. The other option, if a supplement, some people may think that that's too expensive, is to choose a Part C or Medicare Advantage plan. Sometimes these are called Medicare replacement plans because they do replace your Medicare. They're private companies that provide the Part C, and they're paid by Medicare to provide that coverage. There's lots of different plans in Winnebago County. At last count, I think about 25 different plans. You still have to pay the $135 Part B premium. And then if you choose a plan that has a monthly premium, you will pay that premium as well. The difference between your supplements and your Advantage plans, with your Advantage plans, you will now have a copay for every service you have done. And so you have to be comfortable knowing that every time you see a doctor or specialist, have a hospital stay, there will be copays for those services. Most of the Part C plans include drug coverage if you need it. There are some people who may have veterans or use our Wisconsin Senior Care that can choose a plan without drug coverage. There's a number of different types of Advantage plans, most commonly an HMO, a health maintenance organization, a PPO, a preferred provider organization. They're going to possibly limit the doctors or providers that you can see, so you want to make sure you choose a plan that allows the providers that you want to use. Moving on to the drug coverage, or Part D. We actually have 2 different forms of drug coverage in Wisconsin. The Part D plans, again, there's many to choose from. They differ in their coverage. They differ in what drugs they cover, called their formularies. They have different copays, and they also have different monthly premiums. Many of the plans this year have a $415 deductible, and in some cases you will have to pay that $415, especially if you're on a name brand drug, before the plan will start covering those medications. We also have senior care. That is drug coverage only. It's a state of Wisconsin plan. It's $30 per year. So for some people, that will work quite well. It is an income-based program. And Julie and I will do that comparison for people if they want to come in and compare Part D versus senior care to see which one would work better for the person.
Moving on, we are going to talk about Medicare open enrollment now. If you currently have an Advantage plan or a standalone Part D plan, you will get what is called an annual notice of change from the plan that you currently have. It should arrive sometime in September. It will tell you what is changing for that plan that you have for the next year. When you get the notice of change, you really should look it over to determine if the changes are okay with you or if you want to make a change for the next year. That time to make the change is October 15th through December 7th. That is called Medicare open enrollment period. From October 15th to December 7th, you can decide to change your plan. If you do change, it will take effect in January, and it will automatically bump you out of the plan that you had the previous year. So you don't disenroll from your current plan. The new plan will just bump you out. Why would you want to change plans? Because every year the Part D and Part C plans change their formularies, they change their premiums, they change the deductible, they also change the co-pays and your cost sharing for some of your medications. A lot of it has to do with the change in drug coverage in those plans. Your plan may cost more next year due to changes in the deductibles or premiums or co-pays. You may find that your plan no longer covers the medications that you're taking, or they may have put restrictions on the medications that you take, like needing pre-authorization or quantity limits, or needing step therapy to stay on the medication, or your medications may have changed from the previous year, and you need to see if they will be covered by the plan that you're choosing. How do you choose a plan? You can call Medicare. Medicare will help you over the phone. You can call the Medigap helpline. You can go to an insurance agent or a pharmacist if you normally go to an insurance agent or a pharmacist. You can do it yourself on the Plan Finder at www.medicare.gov, or you can call, for local assistance, you can call the ADRC and they will connect you with Joan or I, and we will help you look at plans to decide if you should change for the next year.
All right, Julie mentioned the Medicare Plan Finder. That is the site that we use. It allows us to enter a person's medications, the strength of that medication, how many milligrams they're taking, how often it's taken. We put in the person's zip code, and then it'll give us a comparison of the plans based on the medications a person is taking. And we're able to print that out. And so a person can compare those drug plans and have a pretty good idea. It is a good estimate, although the drug companies do change their drug costs from time to time. So it is just a good estimate of what the drug costs would be. Your results when you look at that Plan Finder are listed from the least expensive plan to the most expensive plan. It takes into consideration, right now, the premiums of that plan. And so, again, it's just a good estimate of what your drug costs will be. It tells you the details, the co-pays that you will pay. It will tell you if there's any restrictions, like prior authorizations needed. And it'll also tell you if the pharmacy that you like to use is a preferred pharmacies. Just like the Medicare Advantage plans has preferred doctors, these Part D or drug plans also use preferred pharmacies. And if you have a favorite pharmacy and you want to use that one, you may want to choose a plan that uses that pharmacy. Because if you choose a plan and it's not a preferred pharmacy, you can still use that pharmacy, but you'll pay higher co-pays to do that. So many people will oftentimes change pharmacies to the lowest costing plan for them. There are a number of different ways to enroll in the D plans. You can enroll in that Medicare.gov site. You can call Medicare. Sometimes an agent will enroll in the D plans. Some agents won't enroll in the D. They'll just do the Medicare Advantage plans. Julie and I are allowed to enroll in the Medicare D plan, so if you want to do a comparison and you are able to make your decision in our office, we can do that enrollment for you. There are some programs to help with those drug costs. There's a Medicare Savings Program that will pay a person's Part B premium, $135 a month. There are income and asset limits to that program, and if you're interested in seeing what they are, just give our office a call, and we can either discuss that over the phone or mail you out our benefit checkup sheet that shows all the guidelines for all the programs we work with. There's also a program called Extra Help. It is actually run through the Social Security office. And both those programs will eliminate or lower the monthly premium for the drug plan and also lower the drug costs. And it eliminates the donut hole, which we are not going to get into that coverage gap or donut hole issue, but it will eliminate that if you qualify for those Extra Help programs. And again, senior care is available for people in Wisconsin. It's only $30 a year, so many people, that is a good option for them. It is creditable coverage, which means if you take senior care and not a D plan, there won't be any penalty for you. Senior care can work with a Part D plan, so for those who go into that coverage gap, senior care could also help and fill in some of the costs while you're in that coverage gap. And senior care is now approved through 2028. If you would like assistance with a plan comparison, please give us a call. We do book up during that open enrollment period, so call early October. We can start scheduling those appointments. The plan finder is not available to us till October 15th, so we don't start scheduling those appointments till after the 15th so that we can do those comparisons for you. And Julie's going to talk about one of the changes now to the plan finder.
For 2020 Medicare open enrollment, the system we use, the plan finder, is changing for 2020. They're coming out with a brand new plan finder. I think it's the first change since they invented the plan finder. Prior to using the plan finder this year, you really have to create a My Medicare account. The next screens we're going to go over are how to create a My Medicare account. It's very easy. If you go to www, either medicare.gov or mymedicare.gov, you'll find a link to click on to either log in if you have an account or to create an account. So you just click on the create an account, and it will ask you to enter information. You have to have your date of birth, your current Medicare number, not the old one that ended in an A or a B or a D or whatever it ended in. You need your new Medicare number that has nothing to do with your Social Security. And then the rest of the information, you enter it, and if you don't want to give them an email, you don't have to give them an email. There's a box to check to say you don't have an email address. You need to check the boxes at the bottom of the screen, which are just disclaimers, and then click next after you enter all of your information. You'll get a security notice alert that you need to read. Click OK, keep going, and then the final step will be to create a username and password. There are, they do have to meet specific criteria, and the criteria will show up on the screen, what you have to include for the username and password. And then it will ask you to choose a secret question in case at some point you forget your username or your password. It'll ask you that question, and if your answer matches, you can recover your username or your password. So once you've done all that, you click submit, and that's it. The next screen will show you that you have been created an account and that you can log in. The reason to create this account is not only to use the plan finder. If you create an account and log out and log back in, it will pull all of the drugs that you've had filled through the year through Part D. It'll pull your medications up for you, so you can see if the medications are still the same or if you need to modify the medications, change the dosage, or add new drugs, or delete drugs you don't take anymore. If you do not go into the plan finder through your own account, you have to enter all of your medications over again, and they're gone. If you get out and come back in, your medications will be gone. Not like the old Plan Finder, which held your medications. You have to use your own account to log in to pull your medications. That account can also be used just to look at Medicare claims. Normally, you only get a notice from Medicare quarterly on what they've processed. But if you create your own account, you can go in there and see claims as they're processed instead of waiting 3 months to say, oh, did Medicare pay for my hospital stay? You can see it as it goes through. So it's a very good account to set up. It's very easy. If you have questions on Medicare, you can call 1-800-MEDICARE, or you can go to www.medicare.gov. You can contact the Wisconsin SHIP Resources, which is the Medigap hotline, the Medigap Part D helpline, the Disability Drug Benefit helpline for people under 60, or you can call the ADRC. Joan and I are both SHIP counselors. You can call us for information on Medicare. And that's it.
Does anyone have questions for them?
So for people who don't have computers, and you run into that plenty, I'm sure, elderly, they're still going to need to go through this, create an account, Medicare, my Medicare account, in order to access the Plan Finder. So
We will do that for them.
you'll do that for them,
Yes.
and with the passwords and all that, you're able to keep those passwords so that if they come back, you can help them get back in.
Yeah, we'd at first they told us we could not do that, but then they
Yeah.
realized
They
that that's
reversed.
not a good idea.
Yeah.
Because people are not going to know the next year. So they said,
Sure.
because since we keep everything locked in our files, they said we could keep that information for people.
So people who already have established a My Medicare account, they don't need to, this is not a separate account for this purpose,
Correct.
right? You
Yep,
can use
same
your,
account.
you're
They already have one,
existing-
great.
Okay.
And it's not going to be fun this year, we don't think, for annual enrollment. So if you can set up your account ahead of time, please do that.
Sure.
Bring your information so that we can log in once you come to see us.
Yeah,
We're just going to have to be patient. We really, maybe it'll be great.
that's really a huge change though, isn't it?
It is
It'll
a
save us from
big,
entering the drugs,
it's
Right.
a
because it'll
big change.
pull it all up for us.
Yeah.
But it will also be time-consuming to start
Of course, in the past, it did save the drug list.
Correct.
Yes.
If you had that.
As long as you wrote it down, right?
Yeah, exactly. So, I mean, you had that ability before, but now you won't have that if you
Correct.
don't have the Medicare account. Go ahead.
I even forgot what I was going to ask, but that's okay. It'll come to me. It wasn't
And maybe
that
we can
important.
put a link to this. It's just a simple sheet on creating your Medicare account, and it has a
Yeah.
space on there to put your username and your password. And I would say also write down your question and the answer and keep it at home so that you have it on file somewhere.
Good idea.
So how long would a visit take normally? Like a half hour, would you say, or either an hour with
At
them?
least an hour. We
At
schedule
least an
at
hour?
least an hour to an hour and a half
Oh,
for
okay.
Part D comparison.
Okay.
And it really depends on, I mean, some people have 2 drugs, that goes rather quickly.
Yes.
But if you have 16 medications, it's a longer appointment.
Sure.
And if they're looking at Advantage plans, that's usually longer than looking at just a drug plan because you have to look at the medical side and the drug side to compare them.
Well, it's a lot of information. People get very confused, so I'm glad you're there to help them. That's really a blessing.
Hopefully we'll be of help this year. Could be interesting.
And I was, from my neighbors, I was given 2 questions. Number 1 is, what if people are not able to come to your office? Do you do the home visits for people like that?
We can do home visits. What we usually try to do is get their med list ahead of time and then just print some plans out, you know, if they don't have a computer at home that we can log on to. If there's a computer at home, we can log on and do it there. But if they don't, then we'll just print those lists and take a couple with us. Yes, we can do home visits.
In our building, there is a computer downstairs, so
Do you have laptops that you can take into the field? You don't? Oh,
No, we would have no way of printing either, so.
Oh, no, that's true.
And the other one was confusion over if someone started with a supplement plan early on, which obviously it's more costly, and then opted to save money, go to an Advantage plan, are they able to go back to a supplement plan again?
They can go back to a supplement if they're healthy. A supplement will take them, no problem. They also have a 12-month trial period once they've left that supplement and gone to an Advantage plan. So they have 12 months to go back into the supplement. The supplement does not have to give them it back at the same price they left, so there could be a rate increase. But if they've been in that Advantage plan for longer than 12 months and they want to go to a supplement, the supplement's going to underwrite them. They're going to look at their health, they're going to ask them a whole list of health questions, and they do not have to accept them at that time.
Okay, and that's what I thought, but I was careful to say, I was going to ask the question here first.
Sure.
Okay. Anyone else?
I just have a question regarding some ads that I've been seeing on television. And, you know, they're prominent people who are doing these. Joe Namath, for example, has been doing this promo on what's called Medicare Coverage Helpline. And the focus is on, you know, Medicare coverage for home aids and rides to your doctor appointments. In addition, I think, to the hearing, vision, and dental. Are there some changes coming or going on regarding, I assume this is not Medicare, this is a Medicare Advantage or a Group
Correct.
C?
Yes,
Or-
CMS has allowed the plans now to offer some of those extra benefits, up to, I think one of the plans offers 12 or 24 one-way visits to doctor visits.
Okay.
You have to schedule it through a particular transportation agency.
I suppose.
So, and some of the, I have not heard of the home health care additions yet, because Medicare has some very strict rules on home health care, so I don't know what that
Yeah.
particular addition is yet, but I know they are offering the transportation. That started last year, that they allowed the transportation
Oh, okay, okay.
included in those plans.
Some of the Advantage plans do cover, I believe it's 14 home-delivered meals, but they're not the daily meals on wheels. They're the frozen meals that are shipped
Yeah,
in.
and that,
Yeah.
that is after a surgery or.
After you
yeah,
leave the
certain
hospital.
hospitalizations,
Yes,
correct.
yes.
And they will also pay for X number of home care aids that are the medical assist, not just the coming in and doing
therapies.
rather than just coming in to be the companion and the housekeeping and things, which has been a great advantage to some individuals.
I imagine that information then is going to be actually online then, with certain plans that they'll have,
Well, I don't, the plan finder doesn't go into
doesn't, oh,
that much detail. At least I haven't seen that on there. I mean, I think you can, I think some of the transportation benefits are on there. Have you seen that on there, the transportation?
No.
Yeah, I'm not sure. I'd have to
The
double
dental
check
and
myself. The dental.
Hearing
Dental,
is
vision,
on
and
there, and
hearing are
vision is
pretty
on there, but
standard,
the
yeah.
rest, sometimes
Yeah.
you have to actually go into the plan's website
Yes.
and look for those specific details.
mm-hmm.
The new plan finder just came out
Yeah.
last week, so we haven't even had time to look at it yet to see what it's gonna look like.
And the dental benefits are just a cleaning.
Right,
There's
yeah, they're
no
limited.
work done, no fillings.
Right, unless you add something on
Right,
with
yeah,
a monthly
there's a
cost.
separate policy for that.
Well, the way this was framed, Medicare Coverage Helpline, it just sounded like,
It's insurance agents
yeah, it's really
trying to
not
enroll you into
CMS,
Advantage plan.
not Medicare. Okay. Okay.
Any other questions for them? Okay. Well, I do apologize for our viewing audience that we don't have the screens that have that information, but it'll be available on the ADRC website in the future, and will also be available on the city website with the Committee on Aging minutes and supplemental information for this meeting. So, again, thank you, ladies.
Thank you
We
for
Thank
having
you.
us.
appreciate your help.
Appreciate it.
I'm going to be looking to the
Okay, and we will move on to old
I'd like
business.
to have one of your copies. I could mention some of what you did, even though the other thing.
Sure.
Thank you.
Okay, Lurton, we'll give you a chance to sit. And then your, any report on strengthening our partnership with neighborhood associations and other partners?
I shared with the representatives of the various neighborhoods much of what Ron had given us earlier. From the Consumer Protection Agency, probably the most important was their hotline number. Because if you use the hotline number, you can they can answer all sorts of questions. For example, threatening phone calls, am I at risk, and so on. Or if I want to hire a contractor, should I or shouldn't I? They also have a senior guide, as Ron had told us, that's available for free, again, by calling the hotline, or you can download it. So that was all very helpful. They also have, for the same hotline, watch out for people coming by after storms. And again, Ron has told us all of that. But went through the 5 or 6 kinds of concerns that you should be aware of and look for. And then I shared with them also the Winnebago Public Health information about the fall prevention classes, Tai Chi, stepping out, so on, and the chronic conditions classes, healthy living with diabetes, with chronic pain, how to walk with ease, and support for caregivers. So all in all, thank you for what you've shared with us, and I'd shared these with the neighborhood associations. You're the representative.
You have that consumer hotline number that you could
Yes, I
You could-
certainly do.
repeat?
Are you ready?
Yeah.
800-422-7128.
Thank you.
And I'll give this to you.
Thank you. Next report, improve access to affordable transportation and delivery services for seniors. And at this time, we don't have a report. Creating community design and policy that supports an age-friendly community. That was Jean. Heidi, I know you were working with her. Is there anything to report?
There's nothing to report at this time. Thank you.
Okay, thank you. Improve communication and visibility of available services to seniors. Ron and Julie?
Really?
I can go under other business. Mine are more events that
Okay.
are coming up.
Okay.
Okay.
Fine.
I have just a couple of updates then. One is on the observation status lawsuit. We talked about that a few months back. It has to do with a person who's hospitalized and is not admitted. They're under observation status and then subsequently go to a nursing home. Medicare will not pay for that nursing home stay. That practice, which has been going on for forever, I guess, is challenged in court. And August 23rd, I received a notice from Justice and Aging, who've been following this. It says, this week, a 7-day bench trial conducted in the Alexander versus Azar, A-Z-A-R, a nationwide class action brought by Medicare beneficiaries seeking the right to challenge their classification as observation status in hospitals. And although care provided to patients on observation status is often indistinguishable from inpatient care, it does not count toward the 3-day inpatient hospital stay required for Medicare coverage of skilled nursing care facility. And it says that the individuals who brought this suit were forced to pay up to $30,000 out of pocket for their post-hospital skilled nursing facility care because of that classification as observation. So the judge in this case now, who's heard this bench trial, has been assigned to this case since it was first filed in 2011. is expected to issue a decision in the coming weeks, and we'll be following that to see what the result of that is. Just a note regarding the class, it's a class action. So the class members are likely to number in the hundreds of thousands. The court cited a 2012 study by researchers at Brown University that identified 918,180 Medicare beneficiaries who experienced observation stays in 2009 alone. Okay. In addition to lacking coverage for very costly nursing home, patients on observation can also face increased costs for drugs taken at the hospital and co-payments for hospital services, as noted by a recent report from the Department of Health and Human Services, Office of Inspector General. So that's a big deal, I think. Certainly if you're hospitalized and are on observation status and then need nursing home care, at least maybe for 3 weeks of rehab, you're going to pay the bill. The other is any questions on that?
So when did that start? 2009 is when observation status started?
Well, they went back to 2009 as far as keeping track of people affected by this. So 918,000 plus were just affected in that year alone. So just think of how many people this impacts since that time. And maybe some of those same individuals, not just
things.
once, but second or third time, yeah. So it's a big deal, and we'll be following the results of that. Another update is back, I think it was in February, we reported that Governor Evers had signed an Executive Order 11 creating a task force on caregiving. It charges the task force members with developing strategies to attract and retain a strong workforce, improve compensation and other benefits for caregivers, and establish a provider registry to help connect more families to the care they need. Many caregivers are family members or unpaid, and this task force looks to help address the needs of all caregivers in Wisconsin. He has now named that task force of 29 members. He did that on August 19th, and they're going to begin their work on September 25th. That's the first task force on caregivers meeting, and there are a few from northeastern Wisconsin here. Just to mention a few, 4 of them basically. Stephanie Birmingham, she's the advocacy coordinator, Options for Independent Living in Green Bay. Lisa Schneider, she's the executive director for Respite Care Association of Wisconsin. She's from Appleton. And Mo-Tao Lee is the co-founder president of Universal Home Health Care Incorporated in Sheboygan. And Carol Bogda, she's the Oneida Nation Social Services Elder Services Coordinator out of Green Bay. And then Sharon Cornell, she's a caregiver for her husband, who's a veteran, and in Appleton. So those are some in the local area. But there's 29 members to this task force. It'll be interesting what they come up with. I don't know that they have a timeline to work within to finish their recommendations to the governor and ultimately, I assume, to the legislature. But we'll find out.
Okay.
That's it.
Any questions of Ron? Okay. Then we'll move on to other business. And Ron, I know you had something on scams.
I did, but I don't. I don't know.
You lost them as well as I did.
I think it had to do with the Medicare stuff that is going to be flying around again now with open enrollment. You're going to see, people getting confused by the messages they're hearing on television and elsewhere that people giving them a cold call saying, I know it's time to sign up for your Medicare Advantage plan. Just give me your Social Security number or your Medicare number, and I'll help you through that ugly process or whatever. And there'll be people who will bite on that, but more to come. I'm afraid.
Does anybody else have one on scams? October 1st, our meeting that day will be an abbreviated meeting. We'll do mostly citizen statements, our work group reports, and other business, because we will also be participating with the Senior Expo at the Convention Center. And so with that, anybody that's on our committee is welcome to come. We'll have a booth there, is welcome to come and help staff it during the day. What we'll be doing is handing out literature. Some of it will be available at other booths, but some of it is more unique to what we've been bringing to our meetings and what we've been finding as we explore further. But part of that is increasing the visibility of this committee to the community and finding out concerns of some of the general public and bringing it back to this committee.
Will be at the convention center.
At the convention center.
And for those who haven't gone, I recommend that you go. Don't have to stay forever, but it's very worthwhile going.
It is. That's how we find some of our speakers. And Jean was here last month talking about it, and I've been at one of the steering committee meetings since then, looking for more speakers, more breakouts, and everything of what would be of interest to the group. There'll also be the flu shot clinic. There'll be blood pressure checks, all of those types of things. Great information, some new vendors this year that haven't been there before.
And music and dancing.
Yes. There's not going to be a stage with a keynote speaker as such as was done the last 2 years, but she's trying to get someone from the Better Business Bureau, because there's really been a lot of emphasis on all the scamming and all the, not just the approaching you personally at home, but some of the business scams and things too. So looking at the changing needs in the community.
And it's starting a little bit later this year, right?
Starting at 9. I
O'clock.
believe it's 9.
I believe it is, yeah.
And runs until 1:30.
That's-
We've got it
Hang
somewhere.
on a second, we're gonna get the answer.
It's in the
momentarily.
minutes.
9 until 1:30,
Yes.
the convention center, yes.
Right.
Time of your life.
Time of Your Life Senior Expo. Okay, if there is nothing else, I certainly,
Oh, I do have a couple
Okay.
of
I'm
other
sorry,
things.
Julie.
That's okay, no worries. So on September 11th at the Senior Center, there's the Brain Health, Brain Fitness Fair, and that starts at 10 a.m. So you can contact them if you'd like to attend. Registration is required. And then also on September 21st, so that's a Saturday, is the Walk to End Alzheimer's here in Oshkosh. It takes place at North High School, and registration starts at 8 a.m.
and wear your purple.
Yes, wear your purple.
Okay.
What time was the brain fitness?
That starts at 10 a.m.
Okay, thank you.
And Bobby, isn't there a lunch that goes a couple weeks later?
The lunch is the same day. It starts at 11:30. You do have to register prior for that.
And it's all brain fitness foods. Yes. Okay. We'll backtrack. Lurton, did you have anything else to?
No, thank you.
Julie Kiefer.
No.
Heidi?
No, thank you.
Sue?
I just had something real brief here about how they're now including older age groups in amongst the people who are having lung diseases from people who are vaping. It used to be just really the young people, like teens and young adults, but now they're finding older people are also being affected. And there's a grouping, it seems to be, from Milwaukee, Waukesha, and Winnebago. For some reason, those counties have an increase in numbers for this vaping problem where people are being hospitalized. So, it's not a good thing. Who knows what's in some of those, especially when they're sold on the black market. A lot of these people who are hospitalized, they've found that they didn't just buy them somewhere that was legitimate. It's just some black market thing. And they can have heavy metals in there. They can have chemicals in there that you have no idea what you're being exposed to. So it's not a good idea,
And one person has died now, I think,
Yes.
as a result of
Yep, there's
vaping.
been one person who's died. And there is a good website here if you want to learn more about e-cigarettes and vaping. Some people just don't know much about it. There's also a 3-minute video, and this is from the Wisconsin Department of Health, and it's dhs.wisconsin.gov/tobacco is changing. So I went there, it was, it's excellent. So if you just want to review it, it's good information. And then the other thing is, here's something to applaud. The State Health Agency is now saying there's been a decline in the number of opioid deaths in Wisconsin. In 2018, there was 836 deaths, and that is a 10% reduction from the year before. So there's a little positivity there.
Now, is that just a Wisconsin stat, you said?
Let's see. Yeah, this is from the state of Wisconsin. Yeah, Wisconsin, state of Wisconsin.
Oh.
Yeah, they are at their lowest level since 2015, according to the most recent data from Wisconsin Department of Health Services. So, anyway,
Still seems a huge number.
yes, still is huge. So, that's all I have.
Okay. Anything else? All right, then I will take a motion to adjourn.
So move.
Second? Anyone?
Second.
All right.